Hi, my name's Ian Hamilton. I'm from the University of York and just wanted to have a quick chat about alcohol during the COVID pandemic. Alcohol is something that really hasn't been talked about a lot. There's been a little bit of policy guidance from the government and from the World Health Organization, and who have made it really clear that I guess the obvious thing that alcohol doesn't protect you from uh, COVID-19 infection. In fact, it does the reverse. It can compromise your immunity. So that's the first thing to say is, drinking alcohol won't in any way protect you in the same way smoking won't either. But there's been a new survey looking at what's happening to population consumption of alcohol since the pandemic arrived or started in the UK. So Alcohol Change UK commissioned this survey of 2,000 people, which is believed to be representative of the wider population. And the top line of this is that 1 in 3 people who were drinking relatively modest amounts prior to COVID have said they are either abstaining now from alcohol or drinking less, not that they were drinking a great deal to begin with. But the other group that's really concerning is the 1 in 5 respondents who were drinking at quite high levels prior to COVID report an increase in their drinking over and above that. So clearly that's a group that we need to be concerned about and think about in terms of how we provide support to them should they want it or need it. At the same time, we have approximately 5% of NHS beds occupied by people who are alcohol dependent at any one time. And given the push for capacity on NHS beds, it wouldn't be surprising if people are no longer being admitted, or fewer than 5% of beds are occupied by people with alcohol dependence. So again, we have to think about what community support is available for these people, and I suspect the charities, the third sector providers who offer specialist drug and alcohol treatment will be doing their best, but in really challenging circumstances. These are services that have faced year-on-year cuts, and at the same time, some of their staff are obviously self-isolating or unfortunately have been infected or even being diverted into other services. So there's reduced capacity in those traditional specialist services to provide support. So I think this is going to be a really tough time for people who are alcohol dependent. And I'd obviously encourage them to contact the GP or to try and get that support from specialist drug treatment. I think for the rest of us, there was 1 in 3 who went drinking a great deal prior to COVID. It'd be interesting to hear what your thoughts are, what you've observed, what you're doing in relation to alcohol. And one of the things we might want to think about is perhaps a dry COVID, is perhaps like those 1 in 3 considering abstaining, or is that just too much? Alcohol's the treat that you look forward to at the weekend, or if you're working after a shift or a period of work. Anyway, really interested to know what your thoughts are about alcohol, what you've observed, what you think should be happening. Please let me know. Thank you.